Good morning, good afternoon, good evening, everyone. Thank you all for joining this webinar. I'm Evelyn Santiago, the Executive Director of the ARNEC Secretariat. I'd like to welcome all of you to ARNEC's second webinar series on ECD and COVID-19, entitled Nurturing Care for Young Children, Seeking Solutions for Addressing Disparities Heightened by the Impact of COVID-19. For those of you who are not familiar with ARNEC, we are a regional network whose main objective is to promote holistic and inclusive early childhood development in the region. We serve as a knowledge platform for ECD professionals and practitioners, and we strongly support cross-country collaboration and learning around early childhood development. We bring to you this second webinar series in partnership with UNICEF, UNESCO, Open Society Foundations, Plan International, Save the Children, and Child Fund Alliance. In this second webinar series, we look deeper into the impact of COVID-19 on the different elements of nurturing care for young children and what policy and program solutions are being undertaken in the countries to ensure that young children are nurtured and protected. We also try to highlight specific actions or interventions which try to address conditions of disparity, because we know that the impact of COVID-19 is worst for the most vulnerable groups. One challenge, however, that we are hearing from the countries is the lack of data to support ECD programs that will specifically address the needs of the most marginalized groups. Can you click the next slide, Joel? Just the same, we hope to surface some examples of interventions which are able to address the needs of the most vulnerable groups. We outline three objectives for this webinar series. First is to generate good practices in terms of local or country level solutions to promote nurturing care and inclusive early childhood development. Second is to discuss evidence-based studies which can help countries refine and redesign their interventions. And third, but most importantly, is to trigger conversations in the region and explore how we can collaborate around multi-sectoral advocacy in support of integrated and inclusive ECD during and beyond the pandemic. For today's webinar, which is already the third webinar session in this second series, we will be focusing on responsive caregiving and what program practices and resources are being implemented in the countries to address the needs of caregivers in terms of supporting the learning and development of young children amidst the pandemic. This webinar will be moderated by Shikha Jain. Shikha is a technical advisor at Plan India, primarily supporting the design and implementation of various ECD and education programs implemented by Plan International in India. She is also a member of the ARNEC Steering Committee. Shikha, thank you once again for agreeing to moderate this webinar, and over to you.
Thank you, Evelyn. A very good afternoon to all the participants and the presenters from what is a very warm Delhi right now. So, Joel, if you can please shift the slide. First things first, let's set some ground rules. It is my duty to inform all the presenters and the participants that this webinar will be recorded and all the resources will be made available on ARNEC's websites afterwards for your quick reference. Please feel free to use the Q&A section, which is located at the bottom of the panel. And also to avoid any repetition of questions, feel free to upvote a question so that we can specify the questions which most people want an answer to. Also, we invite you to become our next member and also sign up and follow us on Facebook to get regular updates. Towards the end of this webinar, we would request a couple of minutes of your time to get a feedback on the session so that we can keep bringing more webinars to you and also making these sessions more and more useful. Next slide, please. So as Evelyn has very rightly set the stage, this webinar is going to focus on the long-term and the short-term effects of COVID-19 on responsive caregiving and parenting. We are trying to specifically look at the challenges and the supportive interventions that can address the issue of responsive caregiving and parenting in these crisis time, and also ensure that the youngest members of our society are able to get the support and stimulation that is needed. So what are some of the evidence-based practices and resources that can be used, and also looking from the critical lens of the duties and the responsibilities of various actors, including governments, including civil society organizations, and also including parents, on how to keep the young children engaged in their homes with the home-based developmental practices so that they don't miss out on the critical foundational years of their lives. Next slide, please, Joel. So without much further wait, let's meet our speakers and presenters today. I am honored and pleased to introduce Dr. Jamie Lackman to the group. Dr. Lackman, as most of you know, is a senior research officer at the University of Oxford Department of Social Policy and Intervention and a research fellow at the University of Glasgow. Today, he'd be talking about parenting in the time of COVID-19, and his discussion will be moving around the insights from the work and the resources of an interagency global response. Next slide, please. Our next esteemed speaker is Dr. Deepu Shakya. Dr. Shakya is an education specialist in UNICEF Nepal. He is also ARNEC's national representative in Nepal. Today, he'd be talking about how can we turn COVID-19 challenges into opportunities while contextualizing the experience of Nepal on promoting responsive caregiving. Our third speaker is Mr. Sandeepan Paul. He's education specialist with UNICEF Pacific, and he'd be talking about the parenting program of UNICEF Pacific's countries with a focus on play. I now invite Dr. Lackman to please start his presentation. Thank you.
Thank you very much, Shika, for that introduction. And it's a pleasure to be here this afternoon, or for me, the morning, as I'm talking to you from London in the United Kingdom. And it's really wonderful to be part of this next series of webinars that are looking at responsive caregiving and moving forward from emergency response to more lasting impact and growth after and during and after COVID-19. I'll be talking about insights from interagency response that I have been fortunate to be part of, along with many others, including my colleague, Professor Lucy Kluver from the University of Oxford as well. So many of you are very familiar with the Nurturing Early Childhood Development Care framework. And really, I just wanted to bring your attention to the three pathways that promote responsive caregiving. One is the need to strengthen caregiver knowledge, attitudes, practices, and behaviors. The other is to foster that enabling environment to support parenting and also to increase the access to quality and evidence-based services. And if you think about all three of those pathways and then the impact of COVID-19, we can see that it had a direct impact on our ability to be able to fulfill those pathways. But why parenting? Why is parenting so important for responsive caregiving? And we know from 77 systematic reviews on parenting done through an evidence gap map that I was part of with the World Health Organization, that parenting programs have shown robust evidence at improving responsive nurturing, child development and educational outcomes, reducing violence against children, improving family relationships, and even improving financial well-being of families, And lastly, the mental health, both of children and of the caregivers. And so there's a robust body of evidence that shows that, that demonstrates that parenting programs can have a positive impact across the life course. Also, we know that looking at early childhood development parenting interventions, they might have a direct impact on child development, but also they address multiple sustainable development goal targets. And you could think of these as accelerators. And so they also have, the evidence shows that they reduce poverty, can address hunger in the family, well-being, but also gender equality, reducing inequalities, and reducing violence and increasing abilities to be productive in society. And we've seen cost analyses of the benefits of implementing parenting programs on a long term. Unfortunately, COVID-19 had many different negative impacts on the well-being of children. These range from social health to economic, to human and social capital, to increased violence, and to increased stress on family relationships. And this really has had a lasting and impact across the board. But as we heard earlier, that it's also most acute with marginalized or vulnerable populations. But we've also seen that there are some accelerators that might mitigate the impact of COVID-19, including social protection like cash transfers and nutrition, parenting programs, and psychosocial support. So I was part of, back in March, a beginning of an interagency response called the COVID-19 Playful Parenting Emergency Response that took together the evidence from parenting programs, primarily Parenting for Lifelong Health and the UNICEF's Care for the Child Development, but other programs to adapt a set of resources to fit the COVID-19 context. And these were then translated into over 100 languages and simplified so that they could be transportable across cultures and contexts. But also we were thinking about their relevance for beyond the COVID-19 or for places that maybe are in different levels of experience. And what we developed was a set of 15 tip sheets and one kind of summary tip sheet. And each one had different types of content, for instance, learning through play, giving parents some tips on how to engage with their children in early learning, parenting with babies as another one, and also like the importance of spending time with their children, but also looking at the experience of caregivers themselves. And so the need to take care of themselves and to manage anger and stress in the family. And the core principles that this COVID-19 parenting response was rested in really led to this rapid adoption across the board. And these were that the principles were that they had to have evidence of impact. So from where they were derived, the resources had to be derived from programs that had evidence of improving child development, but also reducing violence against children and improving overall family well-being. They also had to be scalable and low cost and easily adaptable so that they could be locally relevant. We made them open source so anybody could take them up, and that they had to have this playful energy and also empathetic to the experience of caregivers. And we really strive to create equitable partnerships and collaboration. And what I'm going to show you now is how the different ways that this rapid adoption transpired across the region. So in social media, over 89 million people were reached through different ways of through like Twitter or Instagram or Facebook, basically by sharing these resources in different ways. In the print media, we have some examples from India, Laos, and Thailand, where they took the resources and actually printed them out and either used them for door-to-door home visiting, or to put posters into different community centers or health centers, like in Thailand. In Thailand and Laos also, they took the resources and made them into public service announcements. And in Laos especially, they took them and put them on USB sticks and then distributed them in 4,800 rural villages. And so this half of the year, they're going to be aiming at increasing that by twofold so that they could reach 100% of the population by the end of this year. In India, Viva took the tip sheets and adapted them into phone consultations. In Pakistan, they were then put into the protection against and help of children against abuse and neglect. Pakistan took them and made them into TV programs and online news broadcasts. In the Philippines, they were also adapted into webinars for frontline service providers that reached 8,000 participants who then were able to use those skills and principles in their ongoing work and support. We've also developed an interactive chatbot called ParentText, which provides parenting with support based on what age group that they're concerned with. And we're currently working in Malaysia, Philippines, Jamaica, and South Africa to pilot this in order to, and this is done in close collaboration with UNICEF country offices through their Rapid Pro system. We're also discussing the possibility of expanding this to Laos, Vietnam, Cambodia, Paraguay, Sri Lanka, and Mexico. Then we also have developed a parent chat, which is taking the Parenting for Lifelong Health programs and adapting it into an online messaging that's facilitated by a trained moderator. And these are being tested in Malaysia, Philippines, Montenegro, Moldova, North Macedonia, and South Africa over 8 weekly units where they don't have to have in-person contact. And one of the things that we're exploring is the hybrid delivery of these, so that if you have a group but then have to go in from in-person to remote, you could then move into some of these other resources. And due to this great kind of collaboration across different resources and different partners, to date, we've been able to reach 144.7 million families and people. And you can see some of the other examples in this, presentation also will be shared. But I think it's really speaks to the capacity and the what happens when you make resources freely available and adaptable by different local partners. We have been doing an impact evaluation to examine the effectiveness and reach of the tip sheets or resources. And although our findings are limited in the research design from only retrospective surveys, we have found overwhelmingly positive outcomes. From 75% of parents reported more parent engagement and play with their children, 89% reported more confidence in having positive relationships with their children, 78% reported more confidence in protecting their children from sexual abuse, and 75% reported more capacity to cope with parenting stress as a result of COVID-19. We also found that over 2/3 of the recipients reported less physical or emotional abuse. And this was from surveys with 548 respondents, including 35% being male carers in Malawi, Zambia, India, Nepal, and North Macedonia. So what we're looking for going forward is thinking about how we can implement a human digital parenting strategy that might start with print and social media, and then also include radio and TV and webinars, hotlines and phone support, text messages and apps, online groups, and in-person programs, really thinking about how this moves in increased intensity and impact. And what with this slide that I'd like to share is really showing how we can think of this as a system of interactive and integrated delivery, where you have on the bottom your population level dissemination, moving towards digital interventions that do not require human involvement, to remote delivery via video conferencing, phones and chat groups, to in-person group programs and intensive interventions for those most vulnerable. And as you can go up this pyramid, or the different levels, you can think of them as greater intensity, but also thinking about how we can create this kind of enabling environment so that we can understand the interaction between them, so that how do population level dissemination how do you build the digital intervention so they build upon those, or they are interrelated between the two different levels. And so one of the things we're thinking about is, what do different local governments and NGOs need to deliver their services? And one is that there's that urgent need for intensive support, really looking at how do we respond to these impacts of COVID-19. The interventions need to be remote, but also integrated with that personal support. We're delivering a digital intervention without that human element isn't as effective as we seen in the evidence. They need to be evidence-based, low cost and non-commercial, being able to also provide governments with a wide range of delivery approaches to be able to fit the context and need in order to reach an entire population at the quick speed that can be customized for different populations or an organization, agency, or government, and integrated within other services so that nurturing caregiving isn't delivered by itself, but is integrated with other kinds of support services like health and economic strengthening. And so our collective vision of, we look at where we're going in the next 5 years, is really to take this opportunity where there's a demand for resources and support, there is a shown need for it, and we do have the availability already of these new kind of approaches to really innovate and continue looking at this hybrid digital human parenting support, to continue evaluating it while we are implementing it, and to make sure that we're evaluating that across different impacts of COVID-19, but also looking at how that accelerates across multiple sustainable development goals. And with that, I'd just like to thank you for listening this afternoon to me. And please feel free to ask any questions, also to visit the website where you can download the resources in over 100 languages, and then adapt them to fit the needs of your own context. Thank you very much.
Thank you so much, Dr. Lackman, for introducing the tip sheets to us. But I thought one of the most exciting parts of your presentation was to really, talk about this integrated delivery system, because that is where often civil society organizations also kind of struggle in how to ensure that the delivery at the community level is really done in a holistic way, and the uptake is really from the country level or the regional level rather than localized community. So I thought that was a very, very interesting aspect of your presentation. There are several questions that have come up in the chat box. In the favor of time, there are few questions that I would like to pose to you on behalf of the participants. The first question is, can you share what factors led to the successful uptake of the resources in the countries? I think you've already spoken about it a little bit, but I think the gist of the question is really to understand what localized factors may really lead to a successful implementation. The second question is on the training, monitoring, and the evaluation support, which is available on the use of these resources. And the last question is the lens of disabilities, of gender, of marginalized communities that you must have used while preparing these resources and also while designing the delivery mechanism. So these three questions, if you can please answer for us, we'd be grateful. Thank you.
I would be happy to do my best. Thank you very much, Shika. So the question about what factors led to the successful uptake in the countries. I think I briefly spoke about this in my talk about how I think there were a few different factors. One of them is that there was a great sense of need. So the COVID-19 really put the spotlight on caregivers, and then because there was an inability to reach them with the normal kind of ways that we provide services in person, there was a need to find some other way of doing that. And by making these resources both open access and able to be adapted to fit that context, then it was something that could be then used and tailored to each different context or country. I think it also really is really helpful to have the collaboration of the multiple agencies that were involved, including World Health Organization, UNICEF, UNODC, the Center for Disease Control and Prevention in the United States, many different, ECDAN was another large partner, and the Global Partnership to End Violence, and having that interagency response provided the resources with that kind of gravitas, but also that ability to look into different networks. And then a critical aspect was that we really quickly tried to translate them in as many languages as possible. And this was done mostly by volunteers. And in the early days with people who are spending hours and hours putting things into PDFs so that you could have a resource for Nepal or a resource for in the Philippines, or one that was translated into Thai. And so I think that was another thing that made these resources created that enabling environment for uptake. And I think the last part was that we were really very we worked really hard to make sure that the resources that were being offered were based in evidence, and that there was a grounding in the science. And I think that was another thing that made these different than just any kind of advice that you could send. And I think if you put all those together, that rapid uptake, it created that environment where rapid uptake was really possible. So then the question about the training and monitoring and support is a really good, really important question. And what we tried to do is we set up these regional kind of coordinators who would provide different either UNICEF country offices or local governments with some training on how to adapt and implement or deliver the different kinds of parenting resources, or to really help troubleshoot or think creatively of how that would work best in their own context. We have also been doing some of this kind of retrospective and pre-post surveys with recipients, but when you get to the large level of population media, we're still in that process of learning about how to monitor those. With the chatbot delivery of ParentText, or with the parent chat or an app that we're also delivering, we have embedded the monitoring and evaluation within the system, so that it is not only gathering information about impact, but also improving or customizing or personalizing the experience of the users or the parents, so that it increases or decreases different kinds of content based on their needs. So in that sense, we're trying to even make that monitoring be part of improving the quality of delivery. And then the last question about what have we been doing for, or how have these resources been adapted or used for marginalized communities, including people living with disabilities and those who are most vulnerable. One of the things that we have to recognize is that, you know, sometimes the ones who are most vulnerable or marginalized have the least access to digital technologies. So relying on digital technologies alone isn't something that is going to provide that support. I think the example in Lao PDR is a good one, where they were able to adapt them into public service announcements, and so able to reach even those in the most rural villages. And this is an example of something that also the government of India with UNICEF was able to do. And I think by finding different mediums of being able to translate these or adapt the resources or evidence-based parenting and nurturing caregiving to in different ways, so that it can be audio, that it can be visual, that it can, all of the tip sheets were also converted so that they would read out for people with visual disabilities. I think these were the kind of things that we were looking at. But then also we looked at how even the content could be more inclusive to different people from different contexts, and also for people living with disabilities, either parents or children. I still think we have a ways to go to increasing this and thinking creatively, especially those who are families who are on the move or refugee families. And this is something that we are looking forward to working together with partners over the next 5 years to look at this kind of how to really address and increase the evidence of effectiveness with these populations.
Thank you, Dr. Lackman. That was really useful. And with the group's permission, I now invite Dr. Deepu Shakya to talk about responsive caregiving and parenting program in Nepal, please. So Dr. Deepu, the floor is all yours now. Thank you.
Thank you, Shika, for the introduction, and thanks to ARNEC for giving this opportunity to Nepal to share experience in parenting. And I think overall the stage has been set by Dr. Lackman on overall nurturing care framework and the global context on these materials. So overall, my presentation, as Shika has mentioned, is particularly focused on Nepal's experience on promoting responsive caregiving. And particularly, I'm limiting my presentation, though there are different interventions by UNICEF Nepal and other organizations on promoting positive parenting and responsive caregiving. This is particularly focused on Nepal's practice on parenting education. So to jump off with the topic, let me start by giving some background and status of responsive caregiving or parenting in Nepal. So first of all, from a survey of our project areas in Nepal, we got the information that in 2017, when we were starting off or reboosting our parenting education package, we had in our project areas, so this is just limited to our project areas, 70% of parents, they didn't know enough to be good parents, so they reported that. And if we go to detailed statistics related to responsive caregiving from National Multiple Indicator Cluster Survey, we know 1 in 4 children under age 5 are left in inadequate supervision. 8 out of 10 children face violent discipline, and only 65% of children in Nepal were developmentally on track. So these were kind of negative statistics, but to look at really slightly to positive aspect actually in terms of early stimulation and responsive caregiving, what we have is like we have at home the children who received or engaged in 4 or more activities to provide early stimulation and responsive care, for example, like singing song or like reading a book to child or taking out for play. So these were actually done mostly by adult house members and less by actually fathers. So this is the overall background. And during the COVID-19 lockdown, additional burden was on caregivers. So UNICEF Nepal was tracking the status of children and family during this period through Child and Family Tracker Survey. So it is a national representative sampling of more than 6,500 households, and it was conducted monthly and through telephones. So the lockdown was imposed from end March till July. So I'm particularly sharing the results from August, when the impact of COVID-19 lockdown was at its peak. So we know in August, 45% of the families surveyed had no earnings. So poverty situation was really expanding, and it was affecting well-being of children. There was increase in children's regressive behavior, social withdrawal, and upsurge in anxiety and aggressivity. And effect was on children's learning as well, with children learning and at home without adequate support. So mostly without alternative learning modality. So only few were attending alternative learning modality, mainly internet, online classes, but mostly children were learning by their own through self-learning. So before going into UNICEF response on promoting responsive caregiving, I would like to slightly highlight or introduce what we were doing pre-COVID-19. And as I said, I'm just particularly focusing on parenting education. We have our parenting website as well, which is quite popular, but for this opportunity, I'm just focusing on our parenting education program. So we are supporting government of Nepal on parenting education based on the Ministry of Education, Science and Technology's parenting education package, which was revised in 2018 based on nurturing care framework. So it was implemented in 700 communities in 41 municipalities, 5 districts, serving nearly 33,000 caregivers annually, and in coordination with Center for Education and Human Resource Development, our local NGO partner, Setograns, and local municipalities. And it has a modular package with 5 mandatory topics based on this nurturing care framework, and additional 25, out of which caregivers can choose 15. So it's kind of a participatory model. And we had significant results achieved in caregivers knowledge, attitude, and practice through our CAP study conducted. This is actually documented by ARNEC in 2018-19 as noteworthy ECD parenting program, which can be accessed through ARNEC's website. So during the COVID-19 lockdown, we had to adapt this parenting education package to radio program because all of our face-to-face sessions were halted due to definitely the COVID-19 lockdown. So it was also kind of a high time to reflect on parenting practices of each individuals or each households, because children were 24 hours at home. As I showed in previous slide, children were stressed and parents were also stressed. Their behaviors were also changing. So we had to adapt the parenting education parenting education into radio program. So in coordination with the Center for Education and Human Resource Development, our national partner Setubras, and Nepal Education Cluster. So we launched the radio program Sikda Shikaudai, meaning learning and teaching, in June. It was 15 minutes bi-weekly radio program broadcasted in 3 languages, covering majority of language population, and it was broadcasted nationally through more than 85 radio stations throughout the nation. So 52 episodes were developed based on the parenting education package and the national nurturing care framework. So each episode started with general information about the topic. Details were presented through interview with experts, and we also had practical tips of child-centered activity to be done at home, which could contribute in holistic development of a child. So what were the results? So overall, the reach itself, it was quite good, with cumulative 3.8 million reach through Facebook Live and repost only. We had this through different mobile apps as well as other sites as well, but this is just a Facebook Live and repost only. So in average, there were 72,000 listeners digitally, or at least 72,000 listeners listening this episode digitally only. And interestingly, the majority were male, so 75% were male. So while our physical sessions were more, majority were female, we found out that actually when we broadcast it digitally or through radio, it is mostly accessed by male. We did a quick survey in December, which was after lockdown. So we think that the reach was quite high during the lockdown period because most of the people listened to radio during the lockdown. 18% listened to the Nepali version only. So because of the limited question, we could only assess the reach for the Nepali version. So 18% listened to the Nepali version. We also had listener clubs formed in 5 project districts and 3 non-project districts as well. And there were 1,336 listener clubs formed, which were regularly listening to the program. The radio program is open source. It's available to download in our UNICEF website. And at least 5 local radio stations approached us to broadcast it voluntarily. We had a quick survey of outputs after our first season, which is after 26 episodes, and with a small survey of listeners, what we found was that a majority of the respondents were listening it more than 15 episodes were being listened, while 14% listened all the episodes. And most of the respondents liked all the content, particularly the skill part. The activity with children was liked by most of the listeners, while 72% liked both general information and expert interview as well. We also confirmed that the application of these activities with children were regularly done by 54% of the listeners. 40% said sometime, and 6% said they did not apply because they didn't had right age population of the children, or they couldn't find time to apply those activities. So to wrap it up, I can say that COVID-19 lockdown was actually really a good opportunity for us to promote reflection in caregivers on their parenting practices. It was really a good opportunity for us to adapt the radio program and kind of scale it up to national level, because the parenting education we were providing was limited to only 30 to 35,000 annually. So with this national expansion, we could reach a massive population, and that was kind of justified from the access surveys that even from the CFT, the Nepali version only was listened by around 18%. And from the sample survey, we can also see that it was also taken up by the caregivers, the activities introduced. So we think that it was quite effective to go through the radio program. But definitely, I think we need further analysis on the effectiveness on the outcome of these radio programs, because I think we definitely need to strengthen the programs, intervention programs, effectiveness through different other modalities as well, like maybe by mentoring or maybe by other support mechanisms as well. So that's it from my side. Thank you.
Thank you so much, Dr. Shakya. I think our biggest takeaway from your presentation was, first of all, the highlighting of the challenges, on the part of parents who are really struggling with positive parenting in the time of these crises, but also the quick adaptation of the resources to the radio program to enable a mass outreach. I think that was outstanding part of your presentation, and we already have a lot of questions for you, but we'll wait for some time and invite Mr. Sandeepan Paul, with the group's permission, to please talk about UNICEF Pacific's program on play. Mr. Paul, the floor is yours now. Thank you.
Thank you so much, Shikha, and very nice to meet everyone. I hope everyone is doing very well. So firstly, I just want to take this opportunity to just say that while I'll be talking broadly around the parent support programs in Pacific, but the focus would generally be around a particular parent support program, which is in Vanuatu. So from the UNICEF Pacific office, we support 14 countries. That it's a multi-country office. So Vanuatu is a country where we have a very comprehensive support, and we have a very well-established ongoing parenting program. The reason being, so I will probably not go much into why parent support is critical, because it has been a lot covered by the presenters beforehand. But just to talk about where we come from, we kind of identify the fact, and based on research evidence, that how at home young children, their early years, their first educators are their parents, their extended family members, their neighbors, their community. So the parent engagement program is basically kind of structured in the form of a parent and community engagement program. And we really emphasize on the interactions and relationships, because that have a very, very strong outcome in terms of a child's developmental outcomes, learning outcomes, as the child moves from home to preschool, and then preschool more towards a formal school. So this is the kind of premise and evidence base we come from. Having said that, the parenting programs we support, or parent support programs that we support, are very much integral to our ECE subsector planning processes, because UNICEF basically doesn't look at a single project approach, but rather looks at a broader programmatic approach. So when we work with ministries, our main effort is to make sure that any kind of programmatic approach fits into the broader EC subsector plan of the ministry, within the broader sector-wide planning processes. Having said that, the parent engagement in Pacific is what I'm going to say is not really is coming from the context of COVID only, because fortunately the Pacific countries did not experience COVID the way other countries did. So we had very few cases, and most of them are border quarantine cases, with only 1 or 2 countries having community transmissions, but that too was contained very well by government. However, the Pacific countries actually face a lot of climate change related emergencies, natural disasters. So the approach towards a response has been towards resilience. So even the COVID response, the way the country governments have been responding has been more of resilience. So in terms of parenting too, the reason why I'm presenting is to showcase some examples that we have in the region, which governments are really considering as very, very strong points, which governments want to strengthen further, empower parents, because futuristically, if such a situation comes, then parents and communities, school communities, they are all well prepared and strengthened enough to respond. In Pacific, there have been CAP studies which have driven the parenting program, like even Deepu was talking about it in Nepal. So, and CAP studies have actually found that in households, there are a couple of challenges that parents face. Reading to children is quite uncommon. A lot of times, parents do not have access to books in several countries. Teachers are not adequately trained to support parent engagement. There is a dearth of father's involvement in parenting process. So these are kind of quite common challenges in the Pacific region, and parenting programs have come in the past also to address some of it. However, one of the basic challenge of parenting programs has been that they have not got institutionalized in the system, in the sectoral plans. And that is why the sustainability has been an issue. So with that kind of a context, I just want to move to Vanuatu, because that's where the parenting program actually started, based on a CAP study, evidence, and then moved through a pilot and is currently being planned for a national scale up. So Vanuatu, as you can see, is a very small country. It's 280,000 people, 80 islands. It's the world's one of the most high-risk countries affected by cyclone, affected by volcanic eruptions, so on and so forth. And that's why Vanuatu experiences a lot of emergency situations which are not directly COVID, but could pose very, very similar experience as COVID. They did experience a lockdown, which was very short because there were no cases, but then the main focus towards early childhood for government has been to strengthen the parent support program that they have. So the parent support program in Vanuatu is basically driven by 4 objectives, and some of it I was trying to connect when Dr. Jamie was presenting. Is the first, we look at supporting the confidence, knowledge, skills, building upon what culturally already exists. We look at transforming those key mindset, attitude, practices where the intervention is needed the most. And then creating a supportive environment, empowering parents, empowering family members to create a supporting environment for the child, and finally influencing the policy and practice, like how the program gets integrated into a policy, into a plan. In terms of evidence, we had, as I was sharing, we had evidence from Vanuatu, which showed that a couple of points were very promising. We did see a lot of households did engage with children. At least 64% of households engage with children for early learning, school readiness activities. But we also saw very suboptimal breastfeeding practices among families. We also saw that the family support was very strongly related to the maternal education. So wherever there are parents who are unable to read and write, they are also not supported enough or they do not have the adequate resources and tools to support children's development at home. Similarly, fathers' engagement has been very, very limited in Vanuatu. The other thing that we observed where most children were exposed to a mix of violent and verbal discipline strategies. So that kind of impacts the mental health and psychosocial aspects of child development. Moving from there, this particular program, which I'm talking about, was built upon this finding, and it kind of sort of covers parents from 0 to 5 years, including children who have suspected or diagnosed difficulties. And more recently, the program has started also working with expecting mothers who are sort of expecting sort of childbirth. It is carried out through a center-based approach in early childhood care and education centers. The ECC teachers, they are the main trainers, and with support from the zonal officers or school improvement officers, they kind of provide the training support. What has been the approach very briefly has been respecting what parents and caregivers already know, sharing experience and drawing on cultural strengths and traditions, providing parents with the evidence they need the most, and building understanding of fundamental principles. Just to quickly cover, these have been the main topics of the program, whereby play has been integrated through all the topics with a very specific focus on play and learning, whereby the main objective has been to sort of help parents recognize the importance of play, equipping them with some practical ideas and solutions of using play in their day-to-day approaches and processes, and then what are the opportunities they could utilize out of their schedule in terms of promoting play. Methodology of delivery has been, I spoke about attention to confidence building, knowledge, skills, attitudes, key concept, factual information, practical ideas, providing these, using more everyday stories, their context, from where they come from, what they have to say, listening more about that and framing the whole conversation around it, games, activities, etc. We have large and small group discussions in these programs. Experience sharing is pretty much open-ended because participants kind of open up, they kind of discuss things very openly when things are open-ended, and there is more scope for participation. Couple of times we have had separate sessions for mothers and fathers to kind of foster, to kind of discuss some specific points, specific ideas, and there has been a use of a lot of visual materials to support the understanding. In terms of the next step, in terms of COVID response, the parent support program, when COVID closure happened briefly in Vanuatu, and then Vanuatu was preparing to respond, the government, the Ministry of Education and Training, they plan to develop a home learning package. And all teachers, they were preparing home learning and development package for children during the closure period. And that time, the parent support program modules, which teachers have been very, very familiar with, which parents have been very, very familiar with, provided a great resource for them to develop these packages, and it reached to around 15,000 children in those particular areas which saw lockdown. And now that initiative is now becoming more systemic in terms of a national package for home-based learning is being developed based on the parent support program, which is being supported through a global partnership of education accelerated funding application. So that is going to be implemented. Teachers will be trained upon across the country. And the program is now being integrated into the national ECD policy. And we also have the sort of a strong buy-in from government for a national scale up. We are also in the process of doing the report based on the N-line survey, and there have been several findings which say that parents, caregivers are applying those newly acquired knowledge and skills in their child, in their process of supporting children. And with that, we also saw that parents actually picked up the storytelling approach very well, because a lot of times when parents can't read to children, they love telling stories, and that is that is something they directly kind of picked up from the program. The hand washing piece had a very, very positive impact, with a lot of families actually a lot of families actually building hand washing stations in their house, promoting that in the family, as well as we did see that parents really appreciated the brain development session, and there was request for more additional sessions around it. So now so with that, I kind of close the presentation, and on the note that we are looking forward to this year and next year to support the ministry in terms of really scaling up the program all across the country. Thank you so much.
Thank you, Mr. Paul, for the wonderful presentation, and once again reminding the group over the challenges of parenting, but also in terms of play and how it is still not socially accepted as a great form of learning, and what can governments and systems really do to sort of facilitate that position and really support parents in promoting play as an integral part of growing up and growth and development. So really thank you. And I think my main takeaway from your presentation was the PSP program's keenness to not just work on the attitude, knowledge, and skills, but also in its own way to work with the social norms and contextual reasons which can really sort of promote responsive caregiving and parenting. So thank you so much for that. If I can go back to Dr. Shakya now, and there are a lot of questions for you, but in the interest of time, if we can actually ask you to briefly talk about two aspects. Number one, there is a lot of curiosity, Dr. Shakya, on the contents of the parenting education package that you were referring to. And I think it will make a lot of sense for the group if you can really talk more about what are the contents and, specific aspects so that, the group members can also, one, understand the package much better, but also try and learn certain aspects which can be then sort of, used in their own context. And also, if you can throw some light on whether you guys are thinking about adaptation of this program to other delivery mechanism. And I know that you have a very successful radio program already. So what are the other delivery mechanisms that you're thinking of, and what are the steps that you're taking for the adaptation and greater outreach? Thank you, Dr. Shakya. If you can answer these questions for us, please. Thanks.
Thank you, Chika. And thank you for the questions. I think the overall, the question on the content will be actually, you can find those details from the ARNEC website because the whole documentation is there on the our parenting practices. But basically to give you a brief gist of what is there. So it's a modular package, as I explained in my presentation as well. And basically there are 5 topics which caregivers can select in the beginning of the course. So in the face-to-face session, what happens is like basically they have to go through a series of sessions weekly or like upon their availability. So mostly they do the classes fortnightly for 1 hour to 2 hour session, and they choose from the 25 topics based on the like good health, good nutrition. Overall, the topics are divided according to the nurturing care framework, which I think Dr. Lockman has also showed the slide. And the 5 mandatory topics are basically on what actually is the parenting education itself, how you should be understanding the early childhood development, and what is your role. We have really focused on the father's role in this package. So there is a separate dedicated session on the father's role as well, the role of them in each development stages. So these kinds of mandatory topics are there in the package. So I again really request to all of the participants to go through that ARNEC site. I think Evelyn has also shared the link in the chat box, so you can go through it. On the adaptation side, so actually we are planning to expand our parenting education to health platforms as well, because the face-to-face modes were delivered mainly through the pre-primary teachers. So they were limited actually. Mostly we call upon parents of children parents of children below 4 years age as well, but mostly majority were pre-primary, children's caregivers. So that was kind of limitation. So now what we are trying to do is we are approaching to Ministry of Health and Population to reach out to starting from the conception stage. So we are also developing some additional resource books based on this package, which can be delivered to the pregnant woman or their partners as well. So that's the adaptation process we are trying to initiate. Thank you.
Thank you, Dr. Shakya, and we will be sure to look up the resources that you've already guided us towards. And if, with the group's permission, I can come to you, Mr. Paul. Once again, thank you for your presentation. Again, I have several questions for you, but I'd just be choosing two in the interest of time. Number one, were you able to target or reach the most vulnerable, marginalized groups of young children in your region? What were some of the identification and targeting practices that you adopted during this process? If you can throw some light on it, that will be very useful. And secondly, what specific challenges do parents and caregivers in the Pacific have? So in terms of their attitudes or their situations or the social norms, if you can pick up a couple of specific challenges and really elaborate them, that will be very useful. Thank you.
Thank you so much, Shikha. So yes, so this program actually reached around 3,575 children and around 2,960 caregivers. They were specifically, this program was targeted in provinces which are extremely geographically remote, which provinces normally do not get the kind of input that a more well-resourced province would get. And we kind of, three or four islands, they were all covered in the program. So that was our basic mode, because that's where the population is also very remote. In terms of socioeconomic marginalization, the population was quite remote. They also do not have access to a lot of digital tools as well as internet. So we basically with ministry's leadership, this identification was done. So that was one. The second thing about challenges that I think, that was the second question. The challenges that parents face normally in Pacific is that a lot of times they kind of there is a kind of preparedness in Pacific. The community aspect in Pacific is very strong. Community always provides for people come together and do things together. But a lot of times, children do face the issues of, very strong disciplinary practices at home. And this has not just been in Vanuatu, in a number of other countries. Quite harsh methods of disciplines are used, so as that is kind of normalized as a practice. The second issue that is faced a lot is that parents do not have access to books. Parents do not have access to enough resources, and also they do not have adequate support to identify locally available resources and transform them into more useful and sort of easy to use play materials. So that is one thing that the program targeted, is to make sure that you don't need a whole lot of financial resources to get play materials, but you can look around, you can go to your seashells, coconuts, you can bottle caps, you can use all of this and sort of have more practical play-based items which you can practice with your children. So these two in terms of parenting have been two strong challenges. The other challenge has been the disability. Pacific countries have a very strong focus on disability. Like, they do identify disability as a point to be sort of integrated in all interventions and all plans that are being done. And that's also because a lot of parents do not have the adequate knowledge to sort of address or work with children who have disabilities. So UNICEF actually has supported a lot of parenting booklets, tips through the parenting programs in terms of if you observe these are the kind of points, these are the kind of challenges your child is facing, these are the kind of things you do. So very easily implementable, adaptive sort of resources, adaptive approaches have been built into the program therefore. Thank you, Shikha.
Thank you so much, Mr. Paul. If I can now come to you, Dr. Lackman, and ask you about the specific lessons that you can share with the group that you've learned in this process of developing and implementing the evidence-based global resources. From your perspective, if you can share those lessons and talk about some insights, please. Thanks.
Thanks, Shika. I'd be happy to do this to respond to or to discuss some of the lessons that we've learned so far. I think one of the things that we've learned is that there can be still a lot of work to building collaborations across the different sectors, and whether that is within the ECD sector itself, whereas sometimes the violence prevention and early childhood development sectors operate in different environments, but also within the gender and adolescent work, as well as the resources that can address reducing intimate partner violence and gender-based violence. And this is the challenge because we work very separately, and sometimes we need to think about how the kind of holistic environment of the family can be addressed. And I think that this is something where we need to think about both programmatically, but also from a scientific level on looking at what are the core components and where are the overlaps, and where can we harness kind of the knowledge that we've already gained through the in-person program research to looking at how we can do this more on a population and media level, based level. I think that the examples both in the Pacific and in Nepal show that we have the capacity to reach large numbers, but still a lot to learn also in how to do robust evaluations of these of our approaches. And so that is one where we still need to learn, and there's a lot of work to be done there. And I think then there's a great advantage of these kind of webinars to sharing and building communities of practice and research amongst networks. The work that ARNEC does and ECDAN and other networks that bring people together to learn. And I think that there's so many great examples, but don't get beyond kind of a certain network. So even these kind of communities of practice that maybe are around different themes where there's more intersectionality there. I think that would be something where we would build our knowledge base and then also inform kind of the way that maybe we can get government leaders to come to things like these, so, or to go to where government is, and building both local and more regional kind of consortiums around nurturing caregiving and violence prevention would be really useful. Thanks.
Thanks, Dr. Lackman. And thank you, in fact, for bringing up the very important point on the government collaboration, which is really an area of challenge for a lot of our countries and contexts. And here I would like to ask for thoughts from Mr. Paul and Dr. Shakya on what were the enabling factors which helped you guys to kind of successfully negotiate that with your governments. Also speaking in the context of many countries where ECD as a whole is really not a government priority. And we are living in the times where ECD and education are going to end up as footnotes to this crisis rather than, areas of focus and concern. So we are looking at reduced funding, but also reduced focus in terms of uptake and willingness of the government to adopt some of these packages and processes. So, so some thoughts from you and some strategies from you, which can help us in negotiation with the government, but also to bring ECD as an area of focus. And like Dr. Lackman has also said that, he's talked about evidence. So some of the practices that you guys believe are important in engaging with the government and really bringing them as on-board partners. Thanks. So if we can start with you, Dr. Shakya first, and then Mr. Paul can please add his thoughts.
Sure. Thank you. And I think this is a really important question. And I think the key component is involvement of government from the beginning. And I think Evelyn has also mentioned this in the chat box that our parenting education package was actually revised in 2016 and then 2018 based on nurturing care framework with high involvement or like close coordination from the government itself. So we revised it, the government's package. And so we are promoting government's package, and it's not totally, something new which we have developed. We have been practicing different things like parenting orientation from early 80s. Then gradually it was, implemented through different government channels, and UNICEF was also supporting some of it. And we were also doing a few other things as well during this period. But I think what is really important is that this ownership from the government from the beginning of for this parenting education package. And then I think during this COVID-19 pandemic, it was really a matter of how promptly we can respond to this crisis. So definitely soon after our March end lockdown, we started preparing for this radio program, and we're able to develop the 52 episode, the plan for the 52 episode by mid-April or end April. So the recording and overall started in May, and then it was broadcasted from early June. So I think the important part is that availability of the package, involvement of the government from the beginning. And also I think the critical role was from the education cluster. So the education cluster is the humanitarian response group of in education sector. And we kind of promoted it jointly throughout the nationwide, so that like everybody shares this package and promotes this radio broadcast. So I think these couple of things helped us to enable and reach the maximum numbers in terms of radio broadcast. Yeah. Thank you.
So from our end here, so Pacific has very strong regional organizations. Pacific Regional Education Framework, which is the PACREF, the Pacific Regional Council for Early Childhood Development, which is a multi-sectoral council. Within that, a learning task force for early childhood education. And these actually have all sort of directors and secretaries from the Pacific Island countries. That is a very strong level of advocacy. And UNICEF has been the secretariat for PRC for ECD. The Learning Task Force for Early Learning also is sort of supported a lot by UNICEF. So that has been a very strong channel for advocacy, and through them, we also have here the Federation of Education Ministers. So the ECE agenda specifically is very well articulated through discussion papers, through strong recommendations, through planning, so joint planning and all of that. So that has been a kind of a preparatory advocacy ground for the work. The second thing that has been is as I was saying about the Pacific Regional Education Framework. So there has been a great opportunity of putting together joint application for Global Partnership of Education. And these joint applications are being like jointly being put up by countries, and ECE has been a significantly big output area within these joint applications. And there is something there we have been able to advocate for a number of parenting-based activities. Similarly, so that is also, so these kind of clusters, these kind of regional bodies have emerged as strong advocacy and resource mobilization bodies for this sector, which kind of answers a point that this sector is oftentimes kind of under-resourced. The other thing, for example, specifically in Vanuatu, in Kiribati, in Solomon Islands, in all these countries, there has been a very strong national early childhood development committees or task forces, which have been supported not only by multiple ministries, but all of these are housed within ministries of education, but at the same time, UNICEF has been able to leverage a lot of expertise to support the work of this multi-sectoral task forces. And these multi-sectoral task forces have been very key in terms of taking these programs ahead. So for example, the National ECD Group in Vanuatu actually were steering the work of National ECD policy, and they made sure that parent support program becomes a part of the policy and thereby a system. I think that having those national level task forces is very important, and then the connection with the regional. And another important point is that the governments have ensured that when they work on COVID-19 response plans, early childhood, and it's not always in the format of parent support, but early childhood is integrated into the program, like home-based learning is integrated into the program. Development of packages for parent support is integrated into those plans, the national contingency plans, and then these are again sort of kind of there's a resource mobilization around these, supported through the accelerated funding applications from the Global Partnership of Education. So I think, I mean, that strong advocacy is very, very important. And the agenda always comes from the government, like government really identifies this as a priority. So I think like these structures and these factors have sort of been the enabling environment here.
Absolutely. Thank you. So as we are moving towards the end of this very exciting discussion, may I ask each of the speakers here if they can briefly, maybe in around a minute, give us the key message or the key insight that they would want the audience to really take away from this discussion. And if we can start with Dr. Lackman, and then maybe Mr. Paul, followed by Dr. Shakya, can really sort of, give us 1 minute insightful summaries of what we have sort of tried to discuss here. Thank you.
Thank you, Shika. I think that the core messages that I would like to kind of leave the webinar with is really how can we harness collaboration with government and NGOs to further the work that we've been doing with the Nurturing Care framework, and really strengthening parents' knowledge, attitudes, practice skills, and behaviors so that we can provide children with the care for development, addressing feeding and nutrition, health, security, and opportunities for early learning, and looking at innovative ways of doing that that are both evidence-based and are reaching those which are the most vulnerable, so that we can foster that enabling environment to support parenting through reducing stress, building social support, managing conflict in the home, and increasing quality services and evidence-based services to support the most vulnerable families with young children in order to provide that optimal care, and looking at ways where we can continue to link with social protection and poverty alleviation programs, but also thinking about more kind of integrative aspects of thinking about how both in-person and remote delivery can be combined to provide the best diverse services and access. Thank you.
For me, the key thought that I want to share is that responsive caregiving or parenting or parent support cannot for any more be seen as an add-on service. It needs to be integrated into plans, into processes, so that it gets the right kind of leadership, the right kind of commitment in terms of funding, human resources, a right kind of implementation, supported by robust monitoring and evaluation. So it is very important that how we work together and support governments to integrate parent support as an integral part of their programs, be it within education, be it within health sector, be it within social welfare, whichever the entry points are, we should take the full advantage and leverage these entry points to make sure that these are well institutionalized and embedded within government plans and implementation processes. Thank you.
It's really hard to be at speaking at last because all the colleagues have almost mentioned everything which was discussed during this webinar. But just to close, I think the main thing is that all the parents want best of their children, and everybody's role, everybody who is working in this area, government or United Nations or other NGOs, its role of us to support parents and caregivers to have them knowledge, practice and some skills of the responsive caregiving, because sometimes it's that lack of knowledge or lack of skills which prevents them to give best opportunity for children. So I think I just want to emphasize the point that we have to come together so that we can provide the good appropriate knowledge and skills to the caregivers so that they can deliver best of responsive caregiving to their children. Thank you.
Thank you so much. And I think this discussion was really exciting. At the cost of being a little repetitive, I've been asked to summarize the discussions, and the discussions have been very wide. So I'll take a couple of minutes to really sort of, kind of share my takeaways from the discussion. I think while talking about responsive caregiving and parenting, like Dr. Shakya mentioned, we have to look at this pandemic also as an opportunity for building back better, which we already are doing in the context of school education. I think this kind of a voice needs to be strengthened much more in the ECD arena also, so that, like Mr. Paul said, the governments are able to take the ECD programs as the main focus area and really kind of invest efforts, resources, come up with robust policy as well as implementation frameworks, so that the NCF is truly adopted and adapted in the country context. I think for me, what made this discussion really, really exciting was the fact that we were talking about a wide spectrum. So on one hand, we were talking with Dr. Lackman about a program which has, in terms of a resource, that the tip sheets have been adopted, implemented, evaluated, and now we have an integrated delivery mechanism here to present and share with all the audience if they want to use the resource and do it kind of do it in their own countries. To Dr. Shakya, where an already established and adapted program was quickly transformed into a mass education program in form of a radio program, and now they are at a stage where they want to kind of evaluate how well this program has had in terms of an outreach and in terms of an efficacy through the radios. To Mr. Paul's program, which after having being implemented for quite some time with quite a number of people, is now ready for a national-wide revision and adaptation. So I think in that sense, we were able to cover the whole spectrum through which any kind of developmental program really kind of travels. And that is why we were able to bring some very insightful thoughts, both in terms of systemic adaptation and adaptation of the NCF, and also ground level implementation. Just to talk about a few factors which I thought were extremely important in terms of systemic adaptation was, first of all, the recognition of the local context and respecting the social norms, while also at the same time challenging them wherever required, so that ECD and responsive caregiving and parenting can be prioritized in the right way. I thought the message very clearly was that we have to generate more and more solid evidence which is backed by science, which is backed by a lot of quantitative, qualitative data, and that is crucial not only to bring various agencies to collaborate on the use of that resource and implement that resource, but also to again reach out to the government and ensure that all the practices that are being learned at the level of particular communities are able to travel back into the system, and therefore the systemic strengthening really takes place. I thought that was extremely important. We've already spoken about the importance of inclusion and really applying the lenses of marginalization in almost all the resources that we are creating, but also the implementation strategies. So taking on board the digital means, taking on board the means of mass education, but also not forgetting the good old traditional means of reaching out to families and communities, because after all, we are talking about diverse populations with diverse access to resources. And needless to say, I think this pandemic has brought back the questions of access and almost all the service deliveries back into the focus area. So that is one thought that should not really be forgotten. I thought government engagement really stuff. I think all the speakers spoke about it. There were a lot of discussion in the chat box also around it. So a lot of insightful discussion, and of course the creation of communities of practice, which will not only strengthen the resources and the implementation, but also really carry on the discourse on ECD, responsive caregiving and parenting forward. I thought that was some very important key takeaways. I will take this opportunity to thank all of you for this insightful discussion, and in the interest of time, hand back the floor to Evelyn for her closing remarks, please.
Thank you, Shika, and thank you once again to all our presenters and participants for, as you said, Shika, very insightful and a very productive session this afternoon. Thank you for sharing all your knowledge and insights on how parents, and caregivers can be better supported so they are able to meaningfully, take care and engage their young children. So we also encourage post-webinar discussions. So please continue to really send your questions, insights, feedback. We have some platforms, to be able to do that. So we have our community of practice on responsive caregiving. So we would be sharing more about that with all of you, and we invite you to be a part of it. Just a couple of requests and reminders before we finally close the webinar. You will receive the webinar documentation summary by email, not later than Friday, so that you'll get a summary of all the insights, and discussions which transpired this afternoon. You will also be able to download all the presentations from our website. So please make sure you visit, our website and be a member, as we mentioned, earlier, if you're not yet a member of ARNEC. The next webinar on this series will focus on security and safety, which is an equally important element of nurturing care. So please stay tuned for the details of that webinar. Last but most importantly, we invite you to complete, the evaluation before you leave. Use the link in the chat box. So Andrea is sending now, is writing up the link in the chat box, or use the QR code flashed on your screen. It will only take, a minute to complete, but will greatly help us in planning our future webinars and other learning events. So again, thank you everyone for a wonderful and productive session. Thank you, and stay safe, everyone.